All right, my second case study that I chose is over George Areola. George is a 54-year-old Hispanic male admitted into the hospital for a common cold, and he also has uncontrolled hypertension as well as high glucose levels. And so a dietitian referral is requested to do a follow-up plan for nutrition education and counseling to promote medication intake and illness prevention. Like I said, George came in with uncontrolled hypertension as well as high blood glucose levels, and he admits to missing medications and only taking his blood pressure medication when he feels like his blood pressure is high. George also admits in his doctor's notes that he does drink 2 to 3 cups or glasses of beer 3 to 4 nights a week, so he does have quite a bit of alcohol consumption, more than I would like to see. And along with that, he also has a low activity factor. Even though he is getting out and he's walking at least a little bit a couple of days a week, it is still not high enough for my liking, especially with both of the diagnoses that he has. And so that is everything that I collected in my nutrition assessment in order to get to my diagnosis. And the important information within this diagnosis kind of stems off of the assessment, looking at his past medical history, or I guess you could say current medical history as well, with hypertension and type 2 diabetes. And it's showing that the uncontrolled hypertension and diet does not support maintenance of his blood glucose levels. And so the nutrition-related diagnosis specifically is high blood pressure and elevated blood glucose levels, resulting in poor dietary habits and a lack of nutrition education. And so my PES statement that I came to is that his poor dietary habits are related to a lack of nutrition education, as evidenced by the patient's inability to adhere to proper dietary guidelines for managing diabetes and hypertension. And so once I gathered my nutrition diagnosis, I am looking into my nutrition intervention to try and help George promote a more healthy lifestyle. And so the two different factors going into this again are prescription planning and goal planning. My prescription planning is pretty easy. I just want him to manage his medical conditions with consistent medication intake, along with dietary consumption that supports his diabetes. So like the DASH diet is kind of what I'm referencing here. I also want to increase his activity level a little bit more, try to get him walking and up at least 30 minutes for 5 days a week, and to try and decrease his alcohol consumption by at least 1 or 2 drinks per week. And so in this goal planning, there's a wide umbrella of goals that I would love to set for the client, but the most important right now, because he does have 2 very big medical conditions going on, is I want him to focus on issues he can control and make plans to solve them. So this could be like just incorporating 1 to 2 days at a time for more physical activity during his day, or learning how to tailor his favorite foods for hypertension and diabetes management. So I saw that he loves to have some traditional Mexican food like rice and tortillas and beans, and so trying to alter maybe those meals a little bit so that it can fit within his culture that he's used to is part of the plans and goals that I want to set for him, and I'm hoping he's one to setting for himself as well. As far as cultural competence goes, I really just want to understand the foods that are important to him and the cooking and preparation techniques, and trying to identify how those can fit into his diet plan, as well as him having family support in this healthcare process. Even if he can't get it at home, try to get it in a support group. So I will be trying to attach some infographics. These are just handouts for George, touching on healthy tips to manage diabetes and hypertension. And to do a follow-up with him for nutrition monitoring, I want to determine his physical activity level and see if that's changed any. Also to determine his blood glucose levels and if they're in the appropriate range after 3 months of seeing him from today. And then to, most importantly, to review his understanding of proper monitoring and care for hypertension and diabetes, as well as keeping a food diary so we can see if he has tried to make those adjustments to his diet.